Hi, I'm Dr. Jessie, and here's a hip mobility routine that you can do every day. It'll take you less than 5 minutes, and it's great for improving your range of motion and the overall feeling in your hips. I give this routine to all of my low back patients because we want our hips to be nice and mobile and flexible. And if they're not, as they're the foundation of your spine, that weight and load is going to transmit up the back. So we want nice, flexible hips. All you're going to need is a yoga mat or a blanket because all of these exercises will be done on the floor. So let's get started. Start out on your back with your knees hip width apart, feet flat on the ground. And we'll lift the hips up on an inhale and exhale as you lower. Lifting up from the hips, you're going to feel your glutes engaged, a little bit of the lower back working, and then lower back down. If you feel any pain in your lower back, then don't lift your hips up quite as high. Keep them a little bit lower until you feel better, you feel safer in your lower back. So you're going to do 10 of these. Lifting up on your inhale and lowering down with your exhale. Then you're going to roll over onto your left side. Stack your knees so that they're not directly in line with your hips. You want them a little bit lower. Then hover your right leg up and start to make circles. So we're going to go in both directions, clockwise and counterclockwise. So whatever direction you started with. We're going to go 10 circles in one direction, start to make your circles a little bit bigger. And then also visualizing that there is a paintbrush at the tip of your knee and that you're trying to make these nice fluid circles. And let's go the other way with our circles. Starting out kind of big and then going back down to small. Being mindful of the way that you're moving your hip in the socket. After that, lower your leg and rest for a few moments. And we'll float that leg back up. Now for this exercise, your knee is going to rotate down. So this is internal rotation of the hip. The knee is going to touch. And then when you come back, this is external rotation of the hip and the toe is going to touch behind you. So if we're adding the breath, you're going to inhale and then exhale as you open the hip. Try to make this an arcing motion, so you're keeping an eye on that knee again, and we're trying to make this nice and smooth. Also, be conscious of the way that you're moving your pelvis. We want to keep the hips relatively quiet. You don't want to let them open as you bring that leg behind you. So we'll do 10 of these, so you probably have a few more. Nice, fluid, arcing motion. And then lowering the leg back down. So for this last exercise, we're going to open up the fascia of the abdomen. So as the torso connects to the top of your pelvis, we're going to open up the psoas, your iliacus muscle, and a little bit of that hip flexor. So you'll float your leg up. You're going to bring your knee into your chest. So this is hip flexion. And then as I extend that leg, now I'm going to allow my hip to open slightly. So I'm finding that end range of my hip extension. So the knee comes into your chest and then bring the leg back behind you. Now you feel that opening across the front of your psoas and your abdomen. Now if these feel pretty good to you, then you can add just a little bit more of a stretch. So my knee's going to come into my chest. Then as I bring this leg back behind me, I'm going to allow this shoulder to dip. So you can see I'm getting more opening and lengthening across the front of that hip and into the thigh. What you want to be mindful of is that doesn't go into your lower back because there is a slight twist and opening of this fascia. So if it feels good and okay in your lower back, then you can kind of explore that end range of this stretch. I also like this because we're using our extensor muscles, our hip, to open up the front. So it's not a completely static stretch. So after you've done 10 of those, then you can rest. Now, if that was 10 was too easy for you, Do another set on this side. If that felt pretty good, then make your way over onto your other side and do the same routine. So I hope that you enjoyed this hip mobility exercise, and I will see you next time.